Lukes. For those that know Veronica Durgan, she's the VP of Data at Saks. So she's heavily involved in the data community, if you're not already familiar with her. And we're looking forward to having her in the near future as well. And as we look at other things that are on the future agenda around data auditability, some open mic sessions where we can have more of a community discussion. We're going to continue to focus on healthcare from time to time as well. So looking forward to all of those opportunities as well here. Let me just do a quick introduction of Tony and Chai. So Tony is leading data governance for St. Luke's. And I'll avoid reading this whole slide to you. I know nobody enjoys that, but you can see here their background. Chai is part of Troy's team as well. And looking forward to having them talk today about that journey at St. Luke's with their data governance and how they've been maturing data governance at St. Luke's. Troy, why don't you tell us a little bit about yourself, and Chai, if you could follow, and then I'll turn it over to you and you can start presenting.
Yeah, I think I know some of the folks here. Been in the Treasure Valley my whole life, worked at Micron for a little bit over 30 years, moved to St. Luke's 5 years ago to start up a data governance team, and some of the journey that we're about to take you on, and hopefully some like key takeaways, actually more than our journey, is what we hope to leave you with. We did win the DGPO 2024 Data Governance Best Practice Award. It's a award given out worldwide, so we're very proud of winning that earlier this year, and we'd happy to share some of our successes with you and what, why, and how. Chai?
Hi, good afternoon, everybody. My name is Chai Pacquing, and I've been in Boise for 10 years now. I moved from Singapore, not new to data governance because I've been doing some data governance when I was in Colgate-Palmolive and Philip Morris and then Intel. And then I've been working with Troy ever since I've moved to Micron from Singapore. Glad to be here.
Great. Thank you so much. We're excited to have you guys as well. I'm going to stop sharing. And Troy, if you want to share on your end.
Hey.
And we see it, Troy, so go for it.
Okay, let me start. So welcome again to this webinar, Navigating Data Governance, a blueprint for success. So just like what Troy mentioned earlier, it has been awarded by the Data Governance Professional Organizations as a 2024 Data Governance Best Practice Award. And we are truly honored to present the first integrated healthcare system to have won this prestigious award. So later on, Troy will be joining me to explain some of the presentation. Next slide, please. So just a brief background for those who are not familiar with St. Luke's. So St. Luke's Health System is a prominent healthcare organization situated in the northwestern United States. Its primary locations are spread across the states of Idaho and Oregon, and we are providing comprehensive medical services and innovative healthcare solutions to our communities that we serve. So we are made up of 8 hospitals around central and southern Idaho. We are proud to be the only locally owned, operated, physician-led, not-for-profit health system in the state. So hi, I hope you got that little bit of background about St. Luke's. So now let's start with a little bit about the data governance team itself. So if you could read that blue on the upper portion of the presentation, it says to establish the ownership, stewardship standards and processes needed to ensure data is managed as a critical asset. So there is nothing special or unique to our mission. What has been a tremendous help in the success we have had is having dedicated group of data governance professionals. And honestly, the data governance part is not a part-time gig. You could say some people will just put in maybe an hour or two for data governance, but for us, it's not. We will get into how we are organized as well, as well as some of our accomplishments in a few minutes. But for the data governance members under Troy's team, so there's one data architect and then 3 business intelligence analyst who reports to him. And we kind of divvy up the work around it. And then the members around the data stewardship, because right now we have 7 data stewardship teams. So we have data science, we have some MBA, we have business management, we have some electrical engineer, accounting, computer science. So it's all across different professionals. And then, as you can see, underneath the Data Governance Center of Excellence, so that's where we are situated, is in that circle with kind of like the Washington, D.C. Um, and underneath, we also manage the data stewardship team. And then we have a cross organization data sharing. So this is around, because we are 3 entities. One is the health system, we have the health partners, and one is the health plan. So we have to make sure that we govern data that is being accessed where it should be and who should be accessing those data. And then the next one is the employees patient work group, which was driven by COVID. So we don't necessarily allow the mix up of information between an employee who's also a patient. So if you're a patient, we deal with who should be able to access your patient information, although you are an employee of the health system. The other one is the Data Release Review Council. So this is making sure that the data that we have within the 4 walls of St. Luke's are secured, whether it's patient data, whether it's health system data, that it gets through a review when we release it outside of our 4 walls. Next slide, please. And then on the approach and framework for data governance, so you will see later on in the timeline, but it all started with a data governance community of practice. So it's a cross-functional leaders, which ties to the executive leadership who reports to a higher executive level. And you will see there's a big group of different professionals around it. There's doctors, there's cybersecurity, compliance, legal, and it kind of captures all the different professionals and executives within the health system. And then the next one is where we are. So this is the data governance community center of excellence, sorry, the data governance center of excellence. This is the diverse, dedicated data governance professionals where me, Troy, and 3 others also sit in. As you can see, we have divvy up the how we govern the data. So there's one who's around capabilities and model. There's around clinical data stewardship. I am on the business data stewardship. And there's one other person who's more engaged on the compliance, data privacy, and security. And then for us to be able to make sure that we are following the best practice, we adopt DAMA. And as you can see here, that's what we have been going back and forth every time we have a data stewardship. And then the last one is we have created a playbook and a training that is right sized for our organization. So it includes the 8 elements of data governance. We do incorporate voting. It shouldn't be that just because there's 8 people sitting from finance, you get 8 votes. It only means that if there's 8 data stewards in a particular stewardship, and if there's 2 that's finance, they only get 1 vote. And then we also create scope for each data stewardship. We have guiding principles as well. And then the last one is we have had created 7 stewardship teams. The first 2 we started back in 2020. You will see it later on our timeline. So with each of these building blocks as our foundation, we have been able to have a meaningful impact on our organization in terms of data quality, processes, and success. So what is the key takeaway from this one is that we make sure that data governance is a team sport. As part of our training, we encourage respectful and healthy conflict. And it always happens that during the discussion, there will be conflict. And we want people to know it's okay to disagree and to be able to represent their area. But at the end of the day, we set the expectation to think and vote with all of St. Luke's in mind. So data quality within an enterprise transcends departmental boundaries, necessitating a collaborative effort akin to an orchestra. So it's the team endeavor. It's essential to have individuals who are only like-minded but also recognize the collective impact of high-quality data. So through this harmonious orchestration, data governance can ensure that every section contributes to the symphony of our organization's data integrity. So in part, it is building and maintaining strong relationship within the stewards and their leaders. So we don't, as much as we can, we don't want people to be voluntold. We want them to volunteer, and we want people who are enthusiasts on the data management. And as data governance professionals, we maintain the trust of our stewards and the leaders, which is very critical to our success. The rule number one is to never surprise someone in a meeting. So we provide pre-readings, we provide all the materials necessary before the stewardship meeting. And the second one is we always ensure that our stewards have their leader support. So we meet with their leaders as well on the side, apart from having the stewards meet at least once or every 2 weeks. Next slide, please. So as mentioned, this is our timeline. We started our first hire, which is Troy, on 2019, which really started on 2018 when that data governance community practice was um, created, and Troy was one of the first hire. And when we initially started out, we did what any self-respecting data governance team would do, that is to start a glossary of terms. And then we can't govern data if we can't find it. So another one of our early initiative was to begin the work on bringing a data catalog. So we started the search until we were able to get a catalog we could surface. Of course, in the beginning, everything was in an Excel file. But we have since moved that to Calibra as our catalog. So it was a combination of Excel and SharePoint in the beginning, and then now we have Calibra. And the third thing I should probably mention is having a North Star. People don't necessarily like to be told what to do. And with a North Star as a reference, we were able to stay on course. We have made some changes on our journey along the way, especially when COVID hit, but we moved directionally towards that goal. The other thing that we've done that you will see in our timeline in 2020 is that we we did HIMSS AMAM, which is around data governance, infrastructure, data content, and analytics. It's a measure of our analytics capability because it was important to have a benchmark to compare our progress against different organizations as well. Of course, when we started, we were at stage 0, but we are now moving into a validation for a stage 6. And then we have the data governance playbook and training, which is the important foundation to kicking off stewardship team. Our playbook is available in our SharePoint. And then the training, we are moving it into an online training because currently we are doing a 2-hour training to train our data stewards. So COVID really afforded us the luxury to not need to concurrently build the foundation and show results to the stewardship teams. And then the other thing is our accomplishments were compiled by never testing a good crisis go to waste and by taking wins where we could. It was not prescriptive from vision we had in 2019, but directionally correct and always to our North Star. So we have been selective on the crisis, ensuring timing and resources fit into the roadmap. We have had projects that we picked up along the way just because it was what we see as a need, like in 2022 when we began the employee as patient data work group. And we will talk about more of what we have here on our timeline. And I will turn you over to Troy to discuss that.
Thank you, Chai. I'll talk a little bit about our data stewardship program and just some of the key successes. Yeah, go ahead.
Hey, Troy, it's Mike Gadowski. Is it okay to ask a question?
Absolutely.
Let you guys go, or would you rather save until the end?
Yeah, let's go.
So I was looking on the timeline, and it was interesting how you guys matured from the SharePoint Excel format of your catalog and glossary to the Calibra one. I was wondering if you could talk a little about the inflection point there and how it came about, and what how you got the go ahead to make that purchase, and what drove it in terms of the maturity.
Do you want to fill that, Chai, or do you want me to?
You can go ahead, Troy.
Okay. So what drove it was just having the ability to discover data, because you can't govern it if you can't find it. And being new to healthcare, most of the members of our team were newer to healthcare. And so we knew early on, like within the first 90 days, I started talking about and saying we needed an enterprise catalog so that we could discover data and understand the relationship of data. So that was really the reason why we started it, and it took us on a fairly long journey to get a data catalog. We went through an RFP process. We looked at several different vendors with different criteria, and so we finally went through and selected and went with Calibra as our enterprise data catalog. And we're working now. We've got the first part up and running, like reports and metrics. So you can see what metrics belong in a report, what reports metrics are using, what data is used inside of them. And we're going to start scaling that here in the future. Did that kind of help, Mike?
Yeah, absolutely. Are you happy with the technology choice? Kind of picked the big gorilla.
We did. Yeah, I think we're happy with the technology choice. The support that they provide is fantastic. All the documentation and training that they have online is fantastic. And there's a Calibra user support group that doesn't include anybody from Calibra on it, that meets once a month, where you can talk to other people in like healthcare, insurance, that type of stuff, who also utilizes it. And so it's been fantastic to have that network to be able to benchmark and talk to. So yeah, we're happy with it so far.
Yeah, good, thanks. Not looking for an advertisement, but just real world experience and how it's going for you. Thanks, that was helpful.
Hey, Troy, can I ask a quick question?
Sure.
Did you guys look at Informatica? Because as we're looking at a data governance tool, we're looking at them as well, and I'm curious what your thoughts were on them.
We did not look at Informatica. We looked at Overledge, we looked at Purview, Elation. We did not stop and look hard at Informatica, but I think in both Forrester and Gartner, they're fairly well respected.
Troy, what would you say were sort of the short list of criteria that you had for choosing a data governance solution? What were the most important criteria to you guys?
User interface, because typically not a lot of people will use an enterprise data catalog. You'll find it mostly to be stewards or technical people. And working in healthcare, right? That's the last thing somebody that deals with patients is going to probably be looking at. So we wanted a good user experience and interface, and then something that allowed us to scalably incorporate stewards from other areas to be able to maintain that system. Those were some of our key criteria.
Oh, that's great. Thank you.
Okay, I'll move on to the next slide. And yeah, if you guys have questions as we go, that's fine, bring them up, or we can do them at the end too. So really, to ensure success, a data governance team has to have balance, and really balance between data governance and data stewardship. And the yin and yang relationship or graphic on the left really represents the necessary components to be successful and be able to move the needle towards quality, trusted data. And so, just realizing, like what Chai said, data governance is truly a team sport. It takes so many different people to achieve quality data, trusted data, good lineage, communication, right? Understanding of policies, procedures, how to apply the rules. It just takes so many different people and resources that having that acknowledgement and realizing that early on for us really helped get our teams up and running. We did create a subject area model, which is something that startup programs often do. It really just helped us understand what were the key functions within inside our healthcare system. And we use that as a, say, North Star to how we stand up our stewardship teams. Half of our teams were stood up using subject area model and making sure that we have the right people in. The other half were really stood up around projects or initiatives that were system priorities, right? The leadership team had got together and said, hey, we need to do these things. And as part of that, data quality and effective data governance and managing data going forward was part of those initiatives. So some of our teams were also stood up around those initiatives. So it's not all about the subject area model, but it definitely is a helpful thing to have. And some of the things that we've accomplished, we've got quite a few things that we accomplished, but I'm just going to highlight a few of them in some of the next slides and talk about how we were able to accomplish them, which is hopefully a good takeaway for folks. But the first team we actually had was a team that's HR and finance. And if you look at our subject area model, they're not typically teams that have commonality. But we did have commonality in the sense that they both have an organizational structure and they both had similar data sets that they were managing just in different systems. And so we were able to, we had people who were interested and passionate about having good quality data between those two systems. So by standing up the stewardship team first, we were able to get some pretty good wins around employee badges and being able to, one, make sure we have a consistent hierarchy. So for us, it's entity, department, work unit, sub-work unit, a couple other layers that wouldn't really matter, but we've got that relationship that people will work in as well as where dollars flow through, and we make sure that it's clean and maintained. And then we were able to take that and work with security to create some a process around ensuring we have the right department printed on badges. So I'll get to that in just a second, but another key thing that we did, it's not on here, but we just recently wrapped it up, and we didn't go much into 2024 here, but point of origin is a data element that health systems have to have. Part of it's mandated through government. But we were looking at it and we could tell that there was some suspect data and we needed to go through, and we did a whole new cross-reference. We built some new training. We reduced the list of values associated with it so it was clear to people what they were. We retrained some of the frontline staff that enters the data. And through that, we should see, we're expecting to see, we haven't seen any bad data yet come through on that one data element. And it was quite an effort to go through because there's a lot of people who enter where somebody arrived at a health system on. So that was one of the things that we did, and it took a lot of different people on the team to pull that off. And something that clued us in that there was an issue in the first place was our quality team, who submits data to the government and to the state, brought forth an issue that we had a couple of cases where somebody had shown up according to the data to the ER and had a stroke. So they volunteered for a stroke, and we know that's not something anything volunteers to go do. So we knew we had an issue we had to go poke on. So the issue came up from a different area. They said, hey, we're seeing some data that doesn't look right. We dug into it. And we're able to reduce the list of values from 19 to 12, create good definitions, and really, completely fix the issue. And now we manage it going forward proactively. So there won't be any additional need as changes need to be made. We'll proactively take care of those. And we'll talk about the practitioner taxonomy means of arrival. We've done a bunch of policies and procedures. We put them into a specific system that we have where we keep all of our documents like that, so it's discoverable if people in the health system want to look something up. And we have a lot of policies and procedures with all the government and state regulation and rules and all the different rules that different healthcare insurers have. So we've got a lot of documentation. Some of the key takeaways that I would say from all of the stewardship teams that we've had, and this came from one of my old vice presidents, but is exceed your authority. So that's one thing that I'm constantly telling the team, and do it respectfully, right? You have to know your organization, you have to know your culture. But if you're ever trying to get something done, if you're ever trying to improve quality around something, or bring people to the table to have a conversation, sometimes you have to exceed your authority to do that. So that's one of the key takeaways that I would that we preach and that we do when we need to. And another thing is that just successful data governance is a little bit more art than it is actual science. Being a purple person who can bridge technical and non-technical aspects of the data, and who understands the importance of the interpersonal relationships, the people, the culture, hey, I've been managing this thing for years. You have to understand that and be able to take that into consideration, because the data piece is actually easier. It's the people, right? And you guys who deal with governance, who deal with quality data, who deal with master data, who deal with any of those things, realize it's more about the people than it is the actual data, because you need the people to agree. So that would be another key takeaway. And in so many of these things, sometimes you get passionate. At least I know I get passionate and I want to have something perfect, but perfect doesn't have to be the final answer. Sometimes it's good enough. So some of these efforts that we've done along the way, and not just these, but other ones, will take better than perfect. So that would be another key takeaway that I would say has been something that contributed to our success and has helped us build the program to where people are, excited to participate and know that if they have data problems, they can bring them to the team and we can help work through those problems and come to a good resolution. So one of the first things we did was just a practitioner taxonomy, and you might not think it's an important thing, but if you work in healthcare, the difference between a provider and a clinician is a big deal. Especially, it's like saying you went to school for X number of years and you're giving somebody credit for something that somebody else didn't do and somebody went through it. So we went through and we built a one-to-one relationship between who was a provider, who was a clinician, who was in advanced practice. There's a bunch of other healthcare stuff on here I won't get into, but at the end of the day, we eliminated 41 unnecessary provider types, and we were able to build better standards around who was what, so it can help with training. The other key thing that it did is our workflows. So when you go to a doctor, anybody who logs into a system and takes your patient data, right, they talk to you, they prescribe whatever you need, they take their notes. Well, there's a workflow associated with the type of provider they are, so that they're entering the right information in the right place and don't have a bunch of extra stuff. You don't want an OB doctor who's trying to do reconstruction on something else, looking through OB notes to kind of get to where they need to. It doesn't make any sense. So they have workflows, and we were able to streamline the number of workflows that our teams had to then maintain. So our technical teams, it was a huge time saver for them. And we had a handful of PAs actually reach out to us and at the end of the day thank us, because they didn't realize why they had a different workflow and different things to enter than their other PA friend who also was in the same exact role, and it's because they had different workflows assigned to them. So we were able to clean that up. So it's more than just that, having that good quality data and what it's tied to and understanding the relationships is big. A couple of things we're working on are just focusing on population, we call them population health areas, but in your organization, if you have a term that means more than one thing to somebody, like we have 7 different versions of population health area in data, service lines too. We have multiple data sets and everybody calls it one thing, but you have to ask for additional context to get clarity to understand, well, which one of these are you talking about? So it's very confusing for reporting. It's very confusing for even conversations and meetings. So we're trying to disambiguate some of these things by adding adjectives and better defining what type of service line or population health area or whatever you have, for your organization that you could apply that to, where you have a homonym that means more than one thing to different people. And we're also currently working on building a taxonomic relationship between all of our different locations and our key systems, so that our first focus is the patient experience when they look at something online, that all the names and what it's called from the time they schedule an appointment to the time they get something in the bill, everything is in sync across all of those systems. So that's one of the efforts that we have underway to go through and make sure that they're all maintained. We've got 26 different systems that have data independently maintained that we're going to work on bringing into sync. Those are some of the efforts. And I'll spend just a minute on just a little bit more of what we were able to do with the department names once we created a process around making sure that we have good cost centers, which are tied to departments and work units. Once we had that process created, we ended up working with the security department, and Chai really facilitated and headed up all this work. But we took what was spreadsheets that they had maintained independently as security themselves that had 253 different departments on them that they would print on people's badges. I mean, as a patient, you can look at somebody's badge and like, hey, are you supposed to be helping me? But we reduced that to 78 to make them clear. Of course, we worked with several other teams of people just to make sure we had the right names on them, but we built it into a change managed process now where security doesn't have to maintain a spreadsheet independently. If there's a change to that organizational hierarchy, we'll work with them and let them know, hey, if somebody comes in and they work in this area, this is what you should be printing on their badge. So it's a much more streamlined process, and it saves time and money and hopefully some frustration. If patients see two people caring for them, they might have something different on their badge. Now we're working towards making sure that if they're in the same role, that it's going to say the same thing. So it sounds like a simple thing, and a lot of organizations probably have already addressed something like this, but we helped, through the stewardship team in that process, help address this issue. And another one that we recently worked on, this is just how somebody arrives at a healthcare facility if you're showing up at a hospital. And part of this is federally mandated that you have to collect this, so that if somebody comes in with some sort of airborne disease or respiratory something, we need to be able to tell the police, the fire, the ambulance, the air ambulance, right? Hey, this person was later diagnosed with this. You might be at risk. You need to quarantine, whatever. So we have to maintain that type of data and know who brings people in. And what we found when we looked at this data, we did a Pareto analysis on it, is that there were way too many people arriving by car. And even in cases where we knew people weren't arriving by car. So we looked at the data, we looked at the process, we had the data steward went and actually job shadowed somebody from patient access who is one of the teams that enters the data, shadowed them for a few hours to kind of see what they were doing, feeling, thinking, how it worked for them. At the end of the day, we reduced the list of values associated with this from 12 to 8. We changed it from being a required data element for every hospital admission to only those that were required by law to record that information. And we since then have seen a 97% reduction. This is an image of a work queue that our patient access team would have to go through that have to go in and touch and enter how somebody arrived. And can you imagine, 2 days later, guessing how somebody arrived at a healthcare facility? If you don't ask the question, or no, you don't need to ask, then how are you supposed to know? So, one is we helped people understand it's not okay if you're entering bad data. Like, we need to call those things out and stop doing that. So we eliminated that from happening, reduced the work queue, cleaned the data values up, and only record it where we really need to. So this was a big win for the team in terms of data quality process, and saved hours of work every month from people having to go in and enter and clear a queue. And I'm going to touch briefly on the Data Release Review Council. Chai talked about it just a little bit. I'm just going to spend a couple minutes and highlight a couple of the things that it has done. It's our longest running team. And Mike asked the question early on about, why did you get a data catalog and why did you think, what were some of the things you were looking for? Being new to healthcare, this is one of the first teams we stood up, and I figured if we could understand what data mattered to us leaving the health system, we would understand what data we needed to make sure we had the right governance process, standardization, ownership, security, right? All those things you need in place. So this team was really stood up. One, because it helped achieve that goal. Two, because there was no one person, two person, or even 20 people that you could go to our organization and say, hey, who are we sharing data with? Where's it going? How often is it going? When was it last reviewed? So this team, this process has been running for 4 years now, reviews all data requests leaving St. Luke's. And we're not reviewing it for the content of the request, right? Somebody needs to sign up for like a cancer list registry or a bone marrow transplant registry. We're not judging the purpose, we're looking at the data. And we're making sure that the data we're sending is aligned with the value and the needs of what we're expecting to get out of that relationship. We've redacted data in about a third of the requests that have came through. Data is valuable. So people are, some are like, hey, send us everything. We'll take what we need. No, we'll send you only what was required and only what we need you to have. So that is our stance. That is our policy. That's how we've been treating it. And we've got 57 questions that we ask. We review them every 3 years. We tie it to the contracting process. Every time the contracts renew, we look at the data again, make sure there's no significant changes. We have modified data use agreements through this team. You can see it's legal compliance, right? It's truly cross-functional. But one of the things I want to call out is that we impact not just us, but back in 2019, CMS for all Medicare patients sent out a note saying that they no longer required Social Security number. The threat of a bad actor having a security breach, right? We hear about it in the news all the time where there's security breaches and somebody's data is hacked. The government came out and said, hey, we don't need SSN in this data set anymore. So y'all don't need to send it. We'll take a unique identifier that's associated to a patient that's not SSN that's in Medicaid and use that. So great. We saw that as we were reviewing a contract that we had. We even review governmental contracts. Like we're not going to say no to those, but we still review it for the data. We were reviewing it and we tried to make a change in our electronic medical record provider did not allow us to make that change. It was a global setting, so we ended up having to work with that provider. And it took several months, but not only as St. Luke's now able to no longer send SSN, and we don't, but any other health system in the country or world who uses the same EMR no longer is forced to send SSN. So it's just one less place for a bad actor to go get some information from somebody that we stopped. So just kind of driving change in the industry, not just our health system. That was a proud moment for us. And then we do have a cross-organization data sharing team. Chai talked about the 3 different parts of St. Luke's. We've got typical fee-for-service hospital. We've got a more population-based service. So you can give an X amount of dollars to take care of these people. If you spend more, great, it's on you. If you spend less, great, you keep the money. So we've got that type of we've got that type of setup, population-based care, and then we're also starting the health plan. And we need to make sure internally that we have policies and procedures and practices and people in place to help make sure that we have the right people looking at the right data at the right time. So we have created a policy, we have a team put together, it's heavy legal, but we've got compliance, we've got cybersecurity, we've got a bunch of folks on it. You can see on the left, I won't go through them all, but it's all about making sure that we are doing what we can do to make sure the right people have access to the right data, and as well as if we can get something quicker because we are vertically integrated, how do we make sure that we get those synergies? So, and that we make sure everything's on the up and up, we document everything. That's what this team is about. And then finally, we do have this is an eye chart. It's not intended to be read, so please don't try to read it. You can, but our SharePoint site just highlights metric glossary and our enterprise data glossary. We've moved them to Calibra since we took the snapshot, but what we have on there is just the criteria that we use to say what's a good metric, what's a good definition, and that we expect to have all of the things that we bring in as a governed values adhere to these characteristics. So there's a SharePoint site. People can look up the data governance playbook, which is our best practices. They can look up training. They can see workflows and whatnot. So that's a place where they can go check stuff out for the stewards. And then on the right-hand side, we have a very light data literacy program. We've been doing quarterly releases, and it's really intended on letting people know that most of the people where we work deal with patients in healthcare and not. They deal with data. They deal with data every single day, every single hour. But that's not their focus, right? It's people is their focus. So this really is intended to be like a quick 3-minute read with like a video or something in there where we highlight some talking points. We break it down into fairly simple terms and really want people to know if you have questions, if you have data issues, data problems, there's a team of people you can reach out to. So that's one of the things that we've done to help spread the word. And then it's just some accomplishments that we've done. Again, we've got 15 policies. We've got more now. This was, we did it at the end of 2023 and just update it yearly. We've got over 210 externally released through DRRC, rationalized and approved and changed. We've got over 708 approved metrics and glossary terms. In our latest outside assessment, it's HIMSS AMAM. It's a scale of 0 to 7. 7 being the highest, like world class. We're stage 6 right now and going for our certification to get to stage 7, but we assessed at 91%. We have 73 stewards. We're standing up one more team in early September. We'll have over 100 stewards at that point. We've got our data literacy publications I just talked about, and then something that is also makes us very proud is we had an independent auditor come in and audit our data governance program as risk. Our risk department brings in and audits the entire health system at different phases, but when they looked at the data governance program, they found 0 high risk issues, which they didn't expect them to, but you never know. It's the reason you have those audits. So that was pretty awesome. And then just to kind of wrap this up, the key takeaways is governance truly as a team sport. And it's important to build the proper foundation for your organization. Where we built the playbook, where we built the training, all stewards have to take the training. We want people to go in ahead of time knowing what to expect and how to play. Take the wins and partnerships where you can. Like I said, HR Finance was our first team, different subject areas, but they were eager to work together and they are fantastic people. It's been a great team. Chai leads it. She does a great job. But take your partnerships and wins where you can, not necessarily where you think they need to be, because those partners are so important. And then just another thing is just actively engage with your mentors for wisdom. And just establish a networking skill of people you can reach out to just to talk to, right? A lot of times you're going to have good ideas in the right place. Sometimes it's good just to talk to somebody. So I highly recommend that, whether it's people or whether it's through things like DGIQ, DGPO, DAMA, Gartner, Forrester, right? There's tons of resources out there. Leverage those for best practices. And then finally, I would say, again, it's important just to exceed your authority. And then with that, I will pause for questions.
Hey, Troy, this is Jeff Dodds. Really enjoyed the presentation. I had a question about data quality. Are you guys using a tool or anything? And if you mentioned this, I apologize, but how are you, I guess, making sure the data is meeting your quality benchmarks and such? If that's be curious. The other question I had too, it's a 2-part question. You've always been good about sharing some of the documents and things you guys have put together, barring of course sensitive data and stuff like that. But or some of this stuff I'd be really interested in getting from you. Is that possible?
Yeah, reach out. We'll have to de-St. Luke's some of it depending on what it is. But yeah, reach out to me. And then just on the quality benchmarking, it's a loaded question. we do it several different ways, and some are better than others, and it's definitely probably not world class, but we will utilize some of the features that we have in Calibra. We do have Prophecy as our master data tool, and we've got a governed provider data mart, one of the first things that we worked on too, and got partnered. A lot of organizations struggle with quality provider data. And that was one of the wins we had early on too, partnering with other folks, but building that out. So we use that as a tool. We also utilize just simple scripts to look at source system A and source system B, and did something change, and why did our process not catch it? So we have a fair amount of those too, where we just use SQL code to look at different systems. A lot of our systems don't necessarily talk very well to each other, and because so much of it is in our electronic medical record, a lot of it happens through there. So it's a really good system that we can look at reporting and stuff through. But if you want to compare it to finances or RevCycle or HR, then you need to pull it into another system. And so we do that, but there's a few different tools we use to manage data quality, and we definitely have a lot of opportunities ahead of us where we could help manage it a little bit better. But in every case where we have put a standard in place, we do set quality rules around ensuring that we maintain that quality data, and some didn't change on us.
Yeah, one good example will be the badges, Troy, wherein there is a system, but the process is a phone tag to get the department to the badge. So we've been working, I would say our data quality system is our data stewards. So they bring to us any problematic data set, are creating policies and rules around it, and we put it in our C360 kind of where people go in to check on standards and policies. So that's what we've been doing. We're doing it system by system. We've struggled a lot with the department names. And so just like one of the examples that we have, wherein there's no standard on the means of arrival. So we really rely a lot on our data stewards.
Thanks for the question, Jeff. I have kind of the same question about access control and data protection, and how are you consistently and thoroughly implementing that? And are you, the governance team, accountable or responsible for that, or is that disseminated responsibility?
Another loaded question. We're a part of that. We work closely with cyber and compliance, who are also like we're joined at the hip on quite a few different initiatives because we care about a lot of the same things. They're more owners, we're more facilitators. But the next team we're standing up is identity management. It's really around getting to role-based provisioning. Right now, we manage people kind of independently. You submit a ticket, you get added to a system, it gets validated, and make sure that you're the right person in the right role to have it. And then we also have temporary access where people can log into. It's a thing called CyberArk, but you can log in and get access if you're, depending on, your role, but you can get temporary access to certain things. So that's how we're able to keep things locked down. But we are moving towards, once we get the new team set up, we're going to move everything as much as possible towards role-based provisioning. And so we're definitely a key part of that.
I have a question.
So would you say you?
Go ahead.
I just can't think.
Go ahead.
I can't think about.
I was just going to ask if you are enforcing the policies.
Today,
for the enforcement.
Today we're not, but tomorrow, as we go through the team view, we'll have we've got a few different software systems that are capable of doing some of that. So in the future, I anticipate that we will be a part of that. It'll kind of depend on what role and what process. I think we probably won't have a one-size-fits-all approach. We'll probably have 2 or 3 that we end up working on, and I expect some of them will be through us, not all.
Sure. Different types of data require different types of technology.
Yeah.
to enforce, right? Yeah. Okay.
So, Sandy, did you have a question?
Yeah. I was just wondering from a humanistic point of view, what tactics you felt were the most successful to just kind of obtain enthusiasm and motivation and get some momentum from all the frontline players.
Having this the COP, that was the top left corner and like the third slide that Chai shared, helps ensure that we have the right forum and foundation. It's hard to keep a group involved like that though, because most of the things that we bring through them have been vetted by the stewardship teams, and 98% of it is good. And they're like, yeah, why are you bringing this to us? So it's a little bit tricky to manage that relationship, but having that strong support so nobody can agree to disagree has been one thing. The second thing is where every time we have a steward, we reach out to their leader first. We need to make sure that A, they're the right person to ask, B, that their leader has their support. And so we typically will reach out to them and talk to them about it. If we haven't engaged with them yet, they're not familiar with the governance team or the stewardship process, we'll usually set up 30 minutes and just have a conversation with them and talk a little bit about it and walk through some of the things that they have. And then we approach the person themselves and see if they're comfortable being the right fit, full-time or ad hoc members. But that's really how we keep and make sure that we have the right people engaged at the right time. And we also let people know. We send agendas out ahead of time every meeting. And if there's something in there, you can't control what's always talked about and what's great to have you in a meeting. If you've got a competing thing, we need to switch the agenda around, or this one agenda item matters to you, try to join for that part, but then feel free to drop off. So we try to be as respectful as we can to people's times. So all those things.
And just to add, honestly, the very beginning of the stewardship, even the data governance was hard because nobody wants to work with us because they're like, we have our own system. We've been managing it this way for the last 10, 15 years. There's a lot of data custodians and it's my data, it's mine. You're not supposed to touch it. So in the very beginning, we've done a lot of we talk to the leader and then we talk to the steward. And then we try to ask them what problems are you dealing with. We take as little as I need a glossary definition, or as small as this table does not conform with what should be in that table, especially for the epic side. So we take as little win as we can and we work our way until the time came that they're the ones who are asking our help. We had to prove our worth in the organization in the very beginning, and we take as much work as we can at the very start. And now that we have built kind of our who we are and what we do, it's now that time that we have more engagement from the people that we need, and they're the ones coming to us with information like, hey, you might want to engage this person when you're talking about location. So we've had a lot of discoveries along the way, but it's really around I would say fostering around talking to people. And Troy has been very diligent about setting up one-on-ones with every leader. I, on the other hand, tried to build those relationship with some of the analysts in the different departments just to try to understand what they're doing and what they're talking about, because clinical terms are something that I don't know.
Chai, that's a
Great.
great segue there. Question I was going to ask as well. I'm amazed that you guys have made this a truly enterprise-wide initiative, because I was assuming you must have hit some resistance along the way. And so I appreciate the way you described it. Anything else you would say about how you were able to overcome the naysayers in the organization?
I would say we've had a hundred of no's and maybe 5, 10 yeses. And with all those yes, we did our very best. Whether it's just spelling out acronyms, we'll take it. Like whatever work they throw our way. I think our biggest win is the Data Release Review Council, because in the very beginning, when we were asking them information, what data are you sharing? Everybody's kind of like, oh, we know what we're doing here. And then we started with a list of questions that we guide them. We just don't show them the question. We set up a meeting that could run from 15 minutes to an hour, just so they understand why we are asking and what we are asking for, so they have a deep understanding of what we were doing. Because if we just send them a questionnaire, it kind of get misinterpreted in such a way that, oh, these people are trying to figure out if I'm doing my job or not. So it's really a lot of, I would say, connection to people, trying to win their confidence that we are here to help them and not to like find faults. Because when you hear data governance, it's kind of like governance. Is it like a police or something? Yeah, something like that.
And
Yeah.
we do
No,
have a
yeah.
couple. We do have a
Go ahead,
couple
Troy.
areas that we're still not in on yet, right? I mean, we've got it's enterprise wide, but there's still some areas that we don't have engagement with very well. But for the amount of resources we have, we couldn't really take on anymore. So yeah, our approach has been, focus on the areas where we can, and it has grown organically. Like Chai said, once we started getting some wins and sharing what those were, other people were like, okay, maybe you guys can help us with some of this, or maybe we can pull the right people together. Now they come to us.
And we are not afraid to like tell people what we've done. I think that's one of the things. Like there's a lot of areas where we have done maybe small things like spelling out acronyms, but we tell them we've done it, because that could pique some interest of somebody within one side of the clinical side, maybe a nursing department, a small nursing department that needs our help. And words spread out to people like, oh, there's a group here that could help us with this thing. And the other thing is the data literacy. We try to make it in such a way that it's relatable. Like when we did what was it, Troy? Like we used Lego as an analogy for the different types of data. So it was very relatable, and people started reaching to us.
No, that's fantastic. Yeah, especially your early wins. Those people quickly become champions for you and can help those people that are hesitant to get on the train to see the value of it. So I think that was great the way you guys played that out. Well, I just want to say thank you again, Troy and Chai. This fantastic presentation, and obviously very valuable to everybody that's here. So thank you again for all the time you put in preparing and presenting today.
Thank you.
Thank you.
Thank you, Troy, and
Yeah.
congratulations.
Yeah, thank you.
It's good
Bye.
to see you, Troy.
Yep.
See you guys.
Hey, watch team. Bye.
Thanks, everyone. Bye-bye.